Welcome to the Health System CIO Show. I'm your host, founder, and editor Anthony Guerra. On today's episode, I'll be speaking with Sahan Fernando, CISO at Rady's Children's Hospital, San Diego. Sahan, thanks for joining me today.
Absolutely. Thank you so much for having me, Anthony.
All right, great. Let's start off. You want to tell us about your organization and your role?
Absolutely. Rady Children's Health, we are now one of the largest pediatric health systems in the nation. We are headquartered in Southern California. We have hospitals all over Southern California, including in San Diego and Orange County. We also provide outpatient services, acute care, primary care, really the entire gamut of services for an integrated health system. But as you heard, we obviously focus on pediatric patients. We are one of the major freestanding children's hospitals in the United States, and we're very proud of our mission. And my role as Chief Information Security Officer over the San Diego region is to work on the enterprise security strategy alongside our Orange County region and oversee day-to-day operations in the San Diego region. But thankfully, the information security team is a centralized function for our organization.
All right, very good. The reason I reached out is to talk a little bit about Operation Vital Signs. That's the Health-ISAC HSCC uh, program that they're doing, that exercise around resilience. You had echoed what they were doing. I think you're involved with Health-ISAC.
That's correct.
Right. So, are you first off, are you participating, or are you just in support of what they're doing?
I am participating, so it's a really, really fantastic idea, and I'm really excited to see how it's pulled off with so many participants all over the United States. As you noted, I am on the board for Health-ISAC, so thank you to the membership for your continued trust in serving. And we're seeing a large amount of interest across the health sector, and it's important to note that Health-ISAC and Health Sector Coordinating Council represents not just the provider space, but everyone involved in the care of patients. And so we are seeing pharmaceuticals and lab sciences and the provider payer side. Everyone is really trying to come to the table and work on how do we advance our ability to be there for the patient when they need and have not have them really have to worry about the idea of, is my provider going to be there, right? Are they online?
Yeah. So it's been an evolution over the past, let's say, 5 years in thinking from sort of ransomware was the focus. People were getting locked out. Systems were coming down. Um, and that IT and IT security were focused on getting those systems back up more from a technical sense of getting them working again. And we've evolved, I think, over the past year or two to really thinking about how IT can support operational continuity, without becoming responsible for that continuity in the sense of figuring out, how do you practice medicine when you don't have your electronic medical record? So I've always been fascinated with that evolution and where that line is drawn between supporting and doing. You got a few areas where things come together. You get the line between IT/IT security and operations, and then you have another line between IT/IT security and emergency management, which we've seen some evolution there. But I'd like your thoughts on how you've experienced, if you agree with this evolution, and how you've experienced it.
I love this topic and so many thoughts. Number one being that I think it really does lean into the idea of the CISO role in particular, but the entire discipline of information security being more of a business partner rather than just a technical risk manager. I really think that has been a natural consequence as the importance has grown alongside our digital experience continuing to be more and more important to us as the consumer, to us as the patient, everyone, to us as an organization. Everyone relies on technology now, and so it it's hard to be effective, in my opinion, in supporting operational continuity if you don't understand operations. And for me personally, I find what we do as an organization fascinating. It's great to have a sense of agency and care about the mission. And so being able to have those conversations and guide stakeholders on help me understand how you do what you do, whether it's in the OR, whether it's in sterile processing, whether it's in the cafeteria. It's all important. And we want to collaborate and empower them to understand what are the risks to them being able to do their function for the organization day in and day out, and what are the mitigating controls and plans, procedures that we can put in place. And so we have a very, very passionate business continuity function. It's a great partner. And we work very closely with them throughout the year on areas for improvement. Like all organizations, we wish we could do more. Transparently, we will not claim we are perfect by any stretch, but we're making the effort. And one example is that we have multiple tabletops throughout the year. Most of them are focused more on are there code silvers where there's an active shooter or natural disasters, things like that. But we have at least one a year that is all about operations, but is focused on the idea of IT disaster, generally an information security event like ransomware or something similar. So there is that technical component, but I always remind them it's still effectively the same thing as a power outage in a sense. You'd still have power in this circumstance, but otherwise you can't use your computers. All these applications are down, even if they're software as a service. We likely have cut off internet access initially just to try and contain ourselves. And so it does also help with that culture of awareness of we all care about being there again for the patient when they need us. And we all have that shared responsibility. And how do we make that possible day in and day out? And so it is an evolution for us. We're working on new governance, especially in our new organization as post merger. And it's a really exciting opportunity to work with especially our clinical folks who they're on the floor just doing the most important work, I would say. I don't think mine is by any stretch the most, but helping them on a more ongoing basis be ready. Downtimes happen, especially on third shift. It seems like they tend to be the most well trained because that's also when the Epic upgrade is or something like that. So they get the most real time opportunities to do downtime procedures. And I've talked to so many of my peers who are further along in this journey where they've started trying to intentionally do not just drills, but actually do some of their upgrades during the daytime so that everyone is getting that experience and they're being a bit more cohesive in their approach. And that's very inspirational approach and speaks to how those folks have built their programs. They have the trust to do that during the day.
Right, right. Well, what's some of your advice for getting closer to operations? I mean, I totally agree with you that understanding operations is the key for any IT executive wanting to support those operations. So, for your colleagues who either are uncomfortable, it can be intimidating, right? I mean, you could be an IT person, you came up through IT. People go into IT for a reason sometimes because they have certain proclivities, maybe a little social anxiety. And now you're being asked to initiate interaction with some very high-powered clinicians who may not be totally open to your request of wanting to know more about what they do, even though it's in their best interest and it's what you have to do. So, what's your best advice to your colleagues, either who just this doesn't come supernaturally, but they know it's critical to being good at their job?
Absolutely. It's also intimidating because some of them want to talk about their issues first and can be very passionate, as you noted, about what they would like to see happen. Hey, I would like to be able to do this. And there's some friction there against certain controls like web filtering or other stuff. I know I run into that on a regular basis, less so as I've been here longer, but those were certainly quite a few of the initial conversations. My advice would be to listen first, to be honest. If I were to maybe pull a reference to Ted Lasso, something like that, where be curious and really listen because you will always learn a lot more if someone else is speaking versus if you're doing all the talking. And I think you need to be genuine with them. Tell them about yourself. You really want to build that credibility. My opinion is that humans really do tend to respond to a someone being genuine and authentic and actually caring. And if you show that to them, they hopefully will respond. And that gives you the opportunity. You don't want to jump straight into problem solving, but at least hear them out and then really let the conversation flow in terms of here are some of the things that you are interested in and what that you are working on, and try and get their opinion to show that you actually care about their feedback. And I think that builds that credibility, and then they want to be a partner with you. And then some people will come to you proactively. I've been very fortunate to have some folks that were really excited to talk when I joined, and those people have been invaluable to our program and how we've accomplished what we've done. A great example is our now CMIO at the time was a physician informaticist, and he was really, really helpful in making some of those connections with physicians and folks who aren't just at the leadership level, but some of the other physicians and nurses and clinicians, those folks who have some really good ideas and are really good kind of day-to-day champions about the program. And so that goes a long way. And then it's okay to still be, an IT nerd and nerd out about what they're doing. I think it's really cool to learn how every part of healthcare works and how do they go about their day-to-day job. And as a hybrid employee, I don't live in Southern California, so I go down on a frequent basis. Whenever I can, I will see if there's someone who's willing to let me shadow and just observe and learn and see how they actually take care of the patient, or again go about their job, because that gives me much more insight into what they're doing. Are there areas for opportunity? Again, you can have a little bit more of a natural conversation, because as great as teleworking is, it is harder to build those relationships over Zoom and Teams day in and day out. So that face-to-face time does really go a long way.
Yeah, I think there's a tremendous amount of insight in what you said that people can use. So much in there about the importance of being truly curious. It's not going to be so you're not going to be successful if healthcare doesn't interest you, or if you're an IT executive or a CISO in any industry, if you're not so interested in the operations of that particular industry, if it doesn't fascinate you or interest you, you're not going to try and learn about it. You're not going to be successful. Get into an industry where you're kind of intrigued by the operations, right? I mean, that's just the key.
Absolutely. They're going to tell if you're passionate and if you care, and they will respond to that.
Yeah, the other thing you said that's really interesting and very practical advice is a lot of times when you do initiate that conversation, you're going to hear you have an agenda in initiating the conversation, things you want to achieve. But like you said, you're going to have coming back at you often, hey, IT guy, my thing doesn't work. And you can't just be like, well, I'm not, you need to put in a help ticket. I'm not here to talk about that, right? That's just really practical advice. Like you have to know you're going to get that, and you have to listen, and you have to sort of indicate you're going to help with that or direct it to the right person, and then try, and you can't be dismissive. It's just very good advice. Any more you want to say about that?
Yeah, it's hard to stop laughing because that is the default response. And it is, then you spend that time explaining why the ticketing system is set up the way it is. And it's not poor advice in the longer term, but to your point, that's not how you want to start the engagement. I think that little bit of white glove service does go a
Right,
long way. And
right.
hopefully you can get them more in that direction. But some people will always email you rather than put in a ticket.
Yeah, and somebody told me that you can help them, but it has to go through channels, because if you do a one-off, then you're the help desk to them from now on, and they may tell their colleagues, "This is this is what you do."
Yeah,
So you can be helpful, but it's got to go through channels.
absolutely.
It's just really it's practical stuff that probably no one teaches you in business school. So very good stuff there. You mentioned tabletops. We're talking about disaster recovery, importance of tabletops. Essentially, I think the exercise vital signs is like one giant tabletop. One of the issues around tabletops is getting participation. This probably goes back to some of the stuff we were discussing around building relationships. People are busy in healthcare, probably as busy as they are in any industry. Um, when you want a time from executives you have to be very respectful of what you're asking. You have to be ready to go. You can't have any false starts and say, okay, this isn't working out. I hope let's reschedule this. Like if you get their time, it's got to work and you have to make use of it well. Like a tremendous amount of forethought has to go into any engagement with these people. It's all got to be well thought out so you don't waste anybody's time because you may not get a second opportunity. How do you get people and people, people will say, well, the CEO has to support it. That'll be one of the biggest messages I hear. Listen, you got to have the CEO. If people know the CEO is behind whatever you're trying to do, they're going to show up. So that's sort of that executive sponsorship kind of theme. But in general, what are your thoughts around as an IT executive, a security executive, getting the participation time commitment from very high-powered individuals, very busy individuals, so you can do these things you need to do in order to execute your job?
Yeah, that's really, it's funny because I had never thought of going to the CEO or the board for those things. I guess the way I was brought up is those things are a bit more tactical. And so I would only bother them for something really strategic. And even the first tabletop I ran here, the CEO attended, but that was of his choice. And I certainly didn't go and say, hey, I would really like you to publicly come out and say something here. It was all at layers below. And so if you have that relationship, that's great. I'm always, to your point, a bit more conservative in how much I bother our CEO because I know how much they have going on. We actually have two currently. And so for me, I think it's a similar answer though, where the first few months I spent just trying to meet folks and understand the org chart and understand who does what and how we do what. And so when it came time to actually start pulling things together, number one, our associate chief operating officer is a really strong motivator, and she understands everything because she's been at the organization for decades,
Uh,
and so she was really helpful in saying, this is who I think should be here, and helped educate me on the Hicks model, which we use for our incident command structure, and who should be in which role, who has those job action sheets, and who would be best. And we ran it all in person for the first one. Basically, we had to do hybrid because the first one is 2021. So infection control kind of limited us how many people we could have in the room. But we we really looked at the relationships we had already built, helped us to get those stakeholders in the room. And then we also leaned on their sense of responsibility in the Hicks structure to ensure they attended. And so it really, you do the work ahead of time, and then ideally you're not having to strong arm people. The other things that I would personally consider dropping in and having, again, that 5 minute hallway conversation where you can strategically and try and catch them a little bit more personally because people are very hit and miss on emails or calendar invites. And then if they have executive assistants or admins, those folks are absolutely amazing. And they are generally, in my opinion, the easier way to get something on those high powered executives onto their radar. So if I'm trying to work with VPs and above, I very rarely go directly to them with a calendar request unless I'm asking their permission to schedule time. It's a lot better for me to work with their admin, and especially if I already have some relationship, then I can say, hey, I'd like to schedule time with so and so, just 15 minutes on this day. Could you help work with me on finding a good slot for me to pop into their office? Something like that. So it's just understanding those levers that are available for you to make it a little bit more effortless for them, and they just have to show up because people do appreciate that if you're not making it difficult to work with you, if you're putting in that effort and showing up basically with, hey, here's my agenda. I did all the work to schedule it. Sometimes they, I did have one time that I worked with the admin for our former COO, and it was scheduled and it was great. And he just was not aware. So when I walked into his office, he was very confused, but graciously still had a few minutes to chat with me. But it can backfire. So sending sometimes that confirmation as a reminder does go a long way.
That's great. Listen, I love this stuff and I love all these practical tips. This is gold. I mean, for anybody who's having trouble or starting out, so to speak, this is gold. This stuff
In
about working
fact,
with the admins and things like that. Like, because sometimes you think, if you let your ego get the better of you, you think, well, I'm not going to interact with admins. But they can, I'm going to interact with the executive, and they can interact with my admin. And if I don't have an admin, then they have to interact. But no, listen, it makes sense. You know, when you were talking, I started thinking about uh, do we still do we still have a very serious divide psychologically in healthcare and probably in every industry between IT and operations, where again, IT is just not quite seen always as that enabler of business and more as a I don't know, like a burden, like, oh, you're gonna bother me, or
cost
oh,
center.
yeah,
Yeah.
you're a cost center, and you just are, we've gotten away a lot from being the department of no, and don't ask IT anything, they're gonna screw it up, or they're gonna say no, and cybersecurity, forget about it, they're gonna say no to everything. So, you mentioned relationships and almost this concept of you reach out to people, you find someone that really embraces your outreach, and that person can wind up introducing you to other. They can be your entree to a larger number of operations people. It's almost like now you've got someone inside the club introducing you to other people inside the club. So, just your thoughts generally on where we are as is there still a big divide between IT and operations, and what do we continue to do on the IT side to break down those barriers?
It's a really interesting philosophical question. And there is a measure of it will depend on your organization. So I'm going to speak a bit more at times specifically and then at times generally. I think there is still a divide, and it's really it's fascinating because everyone uses technology in this day and age. The whole stereotype of the old physician who just doesn't even want to use technology and all those things that I haven't seen that personally at Rady Children's. That's really not a thing. Everyone seems to want more technology things to do, and very rarely has a an instance where they say, I don't want to use this, unless it's, new multi-factor system or something like that, to your point. Things that they either do or they perceive to create friction or is a change. That's just inherent human nature and isn't unique to the clinician population. But trying to explain these technical things is difficult, especially I would say for the security folks where you're talking about technical risks that have business impacts. That's where I think some of my peers who are really standout folks, they do a great job of being able, right? The term is translate, maybe overused, but it's not inaccurate. Being able to essentially get someone to a level of understanding of this item over here, I'll explain as much as I can or should, but from an outcome perspective, I hope you're trusting me to say that this is a big enough deal that I need you to take some action or just back me on fixing it and remediating it. So that's one area where there can be some divide, in my opinion. And that's where the stereotype of people going and giving these very technical presentations to non-technical stakeholders, that will widen it because the message is just completely lost. And then personally, I think there's some of the delivery in that because then you get really excited and it's almost like Tommy Boy where you're speaking really fast and excited and you just get too much and then all they really are thinking about is what's going on with the delivery rather than the actual substance of the message. And so it's it's another area where we all are continuing to refine how we deliver the message. And I really have to think sometimes about intentionally pausing rather than using those filler words. People hear that, controlling my pace, enunciating so that, especially over a digital medium, it's received in a more concrete way, or at least I hope so. Another area from a philosophically interesting spot, I would say, is that as the consumer technology market has exploded over the last decade, 2 decades, we run into that friction of things that are really targeted at the consumer first, that the consumer then wants to bring into the enterprise. And they just know that it works really well in their personal life. And then you're constantly having those conversations about why that might not work right now or just can't work in the business context. And so looking at maybe the two really glaring examples that have been on the list for several years, the easy one about artificial intelligence, OpenAI being kind of first to market really targeted the consumer, and that's really quite smart because by capturing the consumer, those people are going to start advocating at the business to have the same functionalities there. And then our attention's being moved, our spend's being moved, everything's being moved over there. And that's not to take a stance on AI is right or wrong or anything like that, but the idea of just the actual kind of marketing strategy, they captured that segment and it kind of forced the business hand to move faster than traditionally would be happening in such a transformative technology. And then something even simpler is so I have an iPhone, I have a watch, great. I don't have an Apple Macintosh. Macs are really hard for security folks. I would say a majority of us in the more conservative healthcare field because they don't operate the same as phones, but people want to use their Mac at at their job. And you have to start explaining why a Mac is different than an iPhone or an iPad, and there's different operating systems, and those are very technical nuances, but the outcome is still trying to convince them again that you're not trying to be obstructionist. It's just not as clear cut, black and white. It's not the same. It's a whole different ecosystem essentially, and those are things that I think are part of the divide is you have to do so much education and that can be fun and it can really I think wear you down a little bit because then you have to decide how many battles are you willing to fight, are you being effective in your messaging, if you're not then that I think that does start to burn you out a bit because you're not moving the needle the way you want to and you're using your time on those things that you would prefer not to versus the bigger picture moving the program forward items.
Right. Yeah, very interesting. I've come across the idea recently has been expressed to me that you can leverage when you figure out what shadow IT is going on, what unsanctioned tools are being used in your environment, you can leverage that knowledge as like a gap analysis to say, okay, they're using it for a reason. Do we have something comparable that they don't know about, or do we not have anything comparable? And maybe you say, I can't have them using this from a cyber point of view. What are we going to do as an organization to give them a tool that they obviously want? So it's just an interesting way, rather than sort of just generally seeing it as negative, you see it as an opportunity to identify a need that's not being met. What are your
Yeah.
thoughts there?
I think that's absolutely brilliantly put. I completely agree. And I haven't heard it put in such an eloquent way, so I really do like that. And we obviously run into that as well, where there's basically the same software being used in a shadow context, and a similar product is already sanctioned and within the enterprise. And there's that time thing that I didn't even touch on in your last question, where how much time do you have to educate and kind of bring them over to, but this is what we've committed to as an organization. And it touches on that change friction that we discussed earlier, where we're all guilty of it. There's certain software that I wish we had here that we don't, and I know how comfortable I was using it, but the organization has picked something else, and I'm working within that decision, right? That was made, and I think that's part of our responsibility in being here is, you can't have 100% of your way, and that just is what it is, particularly in some areas like this. And I would be remiss if I didn't advocate and mention one other area of IT divide. There's insatiable demand, and there's really just not enough resources to meet that, right? Folks will always want as quick of a turnaround on their requests for, break fix or net new. And basic economic theory says there's limited resources, the organization has to decide what is worth funding, especially from an OpEx or FTE standpoint. How many people can we really put in IT relative to all these other areas? And that's a really tricky balance. People, especially certain areas, might advocate well and have the VIP support and a dedicated field services and user tech. And then you start getting into political dynamics. So it is really, really quite interesting for IT. How do you balance the who gets what from a resourcing standpoint? Compute, people, software, all those things. And I really, I really watch us trying to find that line, day in and day out and prioritize the requests. So I'm sorry, I forgot to mention that, and I really think it is really
Oh,
important
it's
because
good.
so many are struggling with that.
Right. And you mentioned a few areas that pull on the demand of IT, and they're not sort of all created equal from a attention point of view. This has come up for decades in IT is if there's not a good intake process and prioritization process, you're running around putting out fires. That takes away resources from net new things, new projects, new initiatives, new evaluations. Those things continually get deferred if you're continually putting out fires because you keep having to pull people off them. Then you've got the KTLO stuff around infrastructure and whatnot, just supporting and paying for what has to be supported and paid for. Sometimes there's not much left for those net new requests. People don't understand that it's not, yeah, we have maybe a good IT staff and we have quite a budget, but 80% of it's taken out before we even look at anything new.
Yeah. And to be full circle here, I think this plays very much into the Operation Vital Signs approach of resiliency. If you're not looking at this systemically, holistically as the KTLO, as you put it, those things really do have an impact on downtime. And it doesn't just have to be a ransomware thing. Even a few weeks ago, we had some switch failures, and our network team did a great job detecting the degradation, having switches ready to go, working with operations on replacing them. But they still had to schedule downtime window to replace those switches and understand the clinical impact. We worked with ops on what are the affected areas, what are the downtime procedures, what can we continue doing, what can we not do during that window. Scheduling the window is very dependent on the affected areas and the patients that were there and the procedures that were running. And so if you don't understand that, if you don't understand the impact of what you're doing, that individual switch really does have a much broader context. Those individual team members have a much bigger piece of the picture that they feed into. And so all of this, where we spend, how we handle requests, how we prioritize the governance, the agreed upon method of intake for break fix and net new and keep the organization going. I think all of that feeds in the idea of what are you targeting from a resiliency standpoint? What are the areas that are, let's say, less critical to the most acute patients? I think that's maybe a fair way to prioritize because first and foremost, do no harm. All of that, I think, cascades into where do you focus on your resources for downtime planning, business continuity, disaster recovery, because the electronic health record is going to be one of your largest priorities from a having it regularly backed up and having the capability and the capacity to restore quickly and into maybe an isolated environment, or maybe you're moving more towards a software as a service model because you want to outsource that risk. But those are all conversations that really marry business and technology together towards an outcome.
You talk about, you mentioned the switch failures and working with operations in order to understand windows of downtime based on what's not going to be available and clinical care and how one impacts the other. It made me think of biomedical devices, which would be where you'd probably have the closest impact between something not working and clinical care. There's been a lot of talk about cybersecurity around biomedical devices. Um, so what are your thoughts? What are your thoughts around securing those devices? How much of a threat is there? How much of a danger is there? What needs to be done around devices like that?
It is a really hard problem. I think as a as an industry, as a sector, we really have moved the needle together. The medical device manufacturers have really owned that they want to make improvements, and it's not just on them. It is on us to advocate on what's practical. It's on them to advocate for what they can do. There's a regulatory component within the FDA, and so there are great people within all of these different areas working together every single day to try and make it less burdensome to have good product security and good operational security. And so the basics do still apply around having things like network segmentation and controlling data flows and really treating them as little eggs you have to protect and put as much compensating controls around them because they are closest to the patient, as you noted. And we certainly do a lot of those things. And then it then it really looks at how do we make it easier? Because a great example is we have a lot of networked biomedical devices. We also have network access control. Sometimes those things do come into conflict when it comes to how do we operationalize and keep those things on the network related to certain security settings. And so we do have those conversations with the medical device manufacturers. I will make a plug that between Health-ISAC and HSCC, I've been fortunate to have conversations with a lot of the people trying to move the needle on biomedical device security, within the FDA, within a lot of the major manufacturers, other providers, et cetera. And so there have been a lot of forums where we discuss our problems and how can we just brainstorm, right? The value of going to those summits and meetings like that is that you do get a bit more of a person to person collaboration. And I can think of several examples where at certain events, which I won't put in name just to so I won't don't sound like I'm sponsoring, but there are certain events I've been to where my friends on the MDM side, we will spend an hour just going back and forth on what does this really look like? Here's some voice of the customer, and really try and help inform the next generation of devices. What does it actually look like when we bring them online, when we bring them into the organization, make it easier for procurement? How much value do you get out of the MDS2? What is the next I'm sorry, the MD the form. I think it's MDS2, but there's so much that we've tried to do to move the needle now. People are looking at SBOMs, and then is there a centralized SBOM? And so there are a lot of people working on solutions is really what I want to emphasize. And in the interim, I think it is that risk management approach of you do the best you can. We certainly look very heavily at the segmentation side and then other things like, do they need Bluetooth or anything of that nature? And that really, we take it modality by modality essentially. And some are a lot easier than others, but those embedded systems, for instance, that helps and sometimes also makes it a lot harder. And then the devices that are a bit more, I think the phrase is dumb, but I'm going to go with simple. They they can actually sometimes really help because there's not much risk surface there, attack surface, and we can just segment them and control the data flows as we need and go from there. But to the last part of your question, when people use that phrase, they love to ask CISOs what keeps you up at night, and there are a lot of things. I don't sleep very well, but the spirit of the question, I think, is worst case scenario for me is a compromise of biomedical devices that are directly attached to the patients. And I usually think infusion pumps, something like that, because that is something from a worst case scenario. I think that's worst case for me.
Yeah, and that's also something where you have inventory challenges, right? We don't even know where they all are because they're very mobile. Sometimes people hoard them not for nefarious reasons, but because they want to know where one is when they need it. So yeah, biomedical, and I think that's in the HIPAA revision that's going to be coming out. More stuff around inventory, more stuff around PHI movement. That's another whole area we don't have too much time to get into. Just, I guess we'll wind up just the final couple of questions around a little bit more about device inventory, the complexity of the biomedical devices, and any thoughts on the proposed HIPAA revision.
I there are a lot of admirable outcomes that are being discussed there, and we're very fortunate there are a lot of groups that are helping bridge the conversation between those regulators and the covered entities that are affected. I think what I'm safe to say is outcomes are great, better security is great. Unfunded mandates are a bit more difficult in this macroeconomic climate. And there is that cybersecurity poverty line that sometimes gets talked about, and that's a real thing. Not everyone can afford every control. And while I'm a big advocate for more maturity and security, it also needs to have that pragmatic understanding of what does this mean to actually put in place. It's great to say have MFA everywhere, but that should also be informed by people who've actually had to put in MFA everywhere and what does that actually mean. And so I look forward to continued collaboration with those who are working to make sure that our regulations keep up with what the market requires to best protect our patients. And I think there are a lot of folks that were happy that the rules didn't go into place last month.
Right, right. It could be any day, right?
I think there's at least a several month period once implemented, but I'm very grateful. There are some wonderful folks that you and I both know doing work on the Hill. We have a great government affairs team that makes sure they're having conversations with us again, that stakeholder ongoing dialogue and relationship building. They ask us, how should we be interpreting this? And they're really working to, again, ensure lawmakers and regulators are understanding the perspective from the provider standpoint on what does this actually mean.
All right, Sahan, that's about all we had time for today. This was a wonderful chat, lots of very practical advice in here, and I appreciate your time, my friend. I hope we can catch up with you again soon down the road.
Absolutely. Thank you so much for having me on again. It's always an honor.
Great. Have a great day. Thank you.
You as well.